That's partially true.
Okay.
The first year that you go on to an Advantage plan, when you first go into Medicare, they don't ask you any health questions going on to a supplement, which is really great for a lot of people. You have 1 year trial right period. If you go into an Advantage plan for the first time.
Welcome to Aging in Style with Lori Williams, the podcast all about finding the silver lining no matter what life throws your way. I'm Lori Williams, an award-winning senior living expert, author, educator, and caregiver to my husband, Mark. Join me as I share insights, tips, and personal stories to help you navigate the world of senior housing, discover ways to pay for care, advocate for your loved ones, and most importantly, learn how to thrive, not just survive, as you age. Hi, welcome back to Aging in Style. Today, we are talking about something very, very, very important, Medicare. Open enrollment or annual enrollment is coming up October 15th through December 7th. And I have with me today Annette Campbell with AmeriLife, and she helped me get my husband all set up on Medicare. So he turned 65 in June and has many health issues. So I went to Annette and said, help me with the very, very best plan for Mark. And she did. And it has been working like a charm because, of course, we've used it quite well and even with the hospitalization. So anyhow, let me introduce Annette. Here she is. Thank you so much for joining us.
Hello. Thank you, Lori, for having me today. I really appreciate it. I like the opportunity to educate people about Medicare and how it works. And as Lori mentioned, the annual enrollment period is coming up. It starts October 15th and it runs through December 7th. And why is that important? Every year, the Medicare Advantage plans and the prescription drug plans change. Every year, they will make changes in the monthly premiums or the copays or the maximum out-of-pockets and things like that. So it's important to do an annual review of your plan. There are lots of different choices depending on where you live. There are lots of different options as far as your premiums, your copays, and things like that. So the annual enrollment period specifically is for people who are on Advantage or prescription drug plans. Now, when you're turning 65, you have some choices to make. You need to make a decision about what kind of care you have.
And just real quick, before we get started, I do want to say this. Before you turn 65, because I noticed this with my husband, I'm thinking maybe 3 months prior, the mail we received, oh my gosh, every day there was something else. And some of them were kind of confusing. And had I not known Annette, I would have thought, oh my gosh, I have to respond to this one. This is the one I need to talk to, because they made it seem very official. But I knew that I was talking to Annette about this. And I may have even called you and said, what is this thing?
Yes. I have a lot of clients that call me and say, Annette, I got this piece of mail, and what am I supposed to do with it? And usually what we tell people is all that stack of mail, you can take it and basically just put it aside, because what you really need is your red, white, and blue card. That's the start. And then you'll make your decision about what kind of coverage you want after that.
And that's what I remember when we met. We were getting all this done like before Mark turned 65. I think it was maybe like a month or so before.
Yep.
And you asked me, did he get his red, white, and blue card? And I was like, huh? And then I thought, let me go look in that stack of mail. And sure enough, there it was, and had his number. And that's how we got everything rolling.
Yes.
So that will come to you in the mail.
That's right. But you better ask for it, because you have to apply for your Part A and B. And that's a good point. When you're turning 65, you have a 7-month window to sign up for your Part A and B. 3 months before your birthday, the month of your birthday, and 3 months after your birthday. Now, sidebar, if you have credible coverage through your employer, that's a different issue. You don't automatically have to sign up for Medicare, okay?
Which we did not, because Mark's disabled.
There you go. So Mark got his card, so we were ready to sit down and make some decisions about which kind of plan he needed. So I'm going to go back just a little bit and explain how original Medicare works, because that's really important. Original Medicare is your Part A and B. Part A is your hospital. That means the room and board, the fine linens that you get, the wake-up call every 2 hours that you get when you come in to check your blood pressure, and things like that.
That's a lot of fun. I just went through that for him.
Good times.
Yeah.
Part A, usually you get that for free, in quotes, for working and paying into Social Security. Now, there can be a premium for Part A if you didn't work and pay into Social Security, but let's assume that you did. So your Part A usually will start the first day of the month you turn 65, and that Part A is free, in quotes. Part A is the hospital. Now, there are deductibles for a hospital stay. There are multiple deductibles, but basically there is a per benefit deductible, benefit period. It's $1,676 per benefit period. That's a 60-day period. Mm-hmm. So that can happen up to 6 times in a year.
Okay.
After that, it goes to a daily rate of $419 per day for days 61 through 90. Mm-hmm. And then it goes, if you're really sick and really in the in the hospital for a really long time, it goes to $838 per day. All right.
Okay.
Now,
unless you have a supplement.
Well,
right?
That's right.
Okay.
This is just original Medicare.
Okay. This is just original Medicare. Okay.
This is why we explain. This is how we have a Medicare checklist. We explain how original Medicare works. So then there's going to be some real big out-of-pocket costs if you just stay on original Medicare. So at that point, you're going to have some choices to make about, do you get a supplement or do you get an Advantage plan? So we'll talk about that in just a minute. But with your Part A, you also have your rehab, okay? Usually if you're in the hospital, when they discharge you, they're probably going to send you to the rehab floor for physical therapy or something like that. That first 20 days in rehab costs you nothing. Medicare pays the first 20 days. But after that, it goes to a daily rate of $209.50, $209.50 per day for day 21 through 100. And after that, day 101 and on, you are on your own. They basically say, we're done paying for your care in the hospital, okay? That's Part A. Part B, on the other hand, that's your doctors. That's the medical, the lab work, x-rays, ambulance, things like that occur in the doctor's office. Also, any prescriptions or medications that you're administered in the doctor's office falls under Part B, okay?
Okay.
Your Part B comes with a Part B, a monthly premium that this year starts at $185 a month. It is based on your income from 2 years ago, so your Part B premium could be much higher than $185 a month, but that's the base rate. After the Part B premium, you also are responsible for a one-time annual deductible of $257. That's the number this year. After you've paid that $257, then Medicare pays 80%, and you're responsible for 20% of the charges. And beyond that, some doctors charge what is called an excess fee. They can charge up to 15% over and above what Medicare approves, and you're responsible for 100% of that excess fee. Okay? That is original Medicare A and B. A is the hospital, B is the doctors and the medical. Now,
A is free in quotes, and B is $185 if you are a certain income.
That's right. Yeah. And it can be more than that. But that's
what is it called when it goes over?
That's your income-related monthly adjustment amount.
Okay.
So
IRMA.
Yeah, your IRMA. That's right.
Yeah.
IRMA.
Okay.
Yeah. If you're making more than about, I want to say $106,000, $103,000 for an individual, or $206
for
as a couple, your modified adjusted gross income, you could have an IRMA increase on the premium that you pay. Okay, that's original Medicare, A and B. Then you need to make a decision. Do you want to have a Medicare supplement, which is you pay a monthly premium, and it will cover a Medicare supplement. Plan G will cover all of those copays and deductibles that I mentioned, all except the one-time Part B deductible, that $257. You pay a monthly premium, and you can go to any doctor that takes original Medicare. All right? It doesn't matter if they're here, if they're in Texas, if they're in New York, if you're traveling, you're on a trip and fall and break your hip. If you're in California or something like that, a Medicare supplement will travel with you. There's also some foreign travel benefits with your Medicare supplement as well. There are many, many companies that offer a Medicare supplement. The only difference in the supplements, if you get a Plan G from any company, the coverage is exactly the same, but the premium that they charge you can be wildly different. So you need to do some shopping to find a plan that's going to...
And we saw that when we were looking for marks, and it was by zip code.
And zip code, your age, you're a smoker or non-smoker, and if you live with someone or not. Okay, household discount can sometimes apply.
So, like, kind of looking at this, just because I know this is a lot of information and it is confusing. So, I'm going to take this as an example. So, Mark has Medicare Part A. We are not IRMA, so yay, thankful for that. So, he has Part A, he has Part B, and we did a supplement. And so, he just went into the hospital. He was in the hospital for 2 days, and then he was discharged. He was taken by ambulance. So for us, everything's paid for, right? I should not receive a bill.
Correct, because he's already met his $257 deductible.
Yeah.
Because he's already been to the doctor since he got his plan in June. Right.
And he's been doing physical therapy. So had I not had that supplement, I would have been on the hook for a lot. I don't even know how much that would be, but 20%. A lot of money.
And that's something important to say. Part B, there is no cap. There's no maximum out of pocket. They're never going to send you a letter and say, oh, congratulations, you've paid enough money for us this year. They're never going to do that. So there's no cap on that. So you're right. You could.
So if you're going this way, do a supplement. Because, I mean, Mark's only been on it since June. We've already had a hospital stay.
A supplement is good. If you're going to do a supplement, you also need to get a prescription drug plan. They cannot require you to get one, but if you don't get one, they can penalize you 1% per month for every month you don't have credible coverage on your prescription drugs. Even if you don't take any medications, you need to have a prescription drug plan just to cover your tail. You need to do it just to protect yourself.
Well, and I know you sat down with me because Mark, and people who follow the podcast know Mark's a stroke survivor, and he's on, 10, 12 drugs, a lot of different medications. And we went over each type of medication he's on, and he was all tier 1 and tier 2 meds, which the med plan was free, right?
Yeah. The cost of that particular premium was free.
Yeah,
that's right.
That premium was free. But we have the premium, but I don't pay anything for it, which is kind of fun.
And we'll review it again to make sure that it's still going to be the one for him for next year.
Okay, so we will review this in the upcoming annual enrollment. Okay.
Yes, ma'am.
Great.
So that's how original Medicare. Now, let me kind of jump off of A and B with a supplement. The other option is to go with an Advantage plan. Medicare Advantage plans, there are two choices on those. There's your HMO plan or your PPO. An HMO is a health maintenance organization. It is managed care. You need to have a primary care doctor. You need to have a referral to see a specialist.
Just like an HMO.
It is an HMO. Yeah. Yes, exactly. You got to have a referral to see a specialist. You need to have a primary care doctor. There are usually co-pays and co-insurances you're going to pay when you go. You may pay $0 to see your primary care doctor, but you may pay $20, $25 to see your specialist on an HMO. It is managed care. It's usually good in the county that you're in and the 5 surrounding counties. If you go outside of that area, you could be considered out of network, which means that all the costs could fall on you.
Which is a problem if, say, you live in, like me, like I live here in Texas. If I had put Mark on an Advantage plan and we traveled to see family in Louisiana and he had an incident, he would not be covered.
That's correct, if he was on an HMO.
If he was on that, yeah.
Also, some of the HMO plans, they do usually have some additional benefits like dental, vision, and hearing, over-the-counter benefits. Some of them have transportation. Some of them have gym memberships. You know, there's different benefits. So it's important to shop your plan every year because those, like I said, those plans do change. You most likely, if you're already on Medicare, you probably have already received your annual notice of change, the ANOC booklet, basically telling you how your plan is going to change for next year. So HMO, PPO, Preferred Provider Organization, that's the other option. If you do that, if you do a PPO, you can go to doctors who are in or out of network. You don't have to have a primary care doctor, but it's still a good idea. You do also have co-pays and co-insurances. Your maximum out-of-pocket is usually higher on a PPO plan. You have more freedom, but with the more freedom, it's going to cost you a little bit more money. You don't have to get a referral to see a specialist. Usually they do include prescription drugs, but they don't have to, and they usually also include some additional benefits. So the decision is yours, and so it's important when you're making these decisions, sit down with somebody who actually does this. If you don't know who to call, you can call Lori, you can call me, or if I don't have a license in your state or something, I have a big company, we can find somebody who can help you. I'd be happy to help you just over the phone if I can't help you in person. Anyway, talk to somebody who actually does this for a living, because every plan is different. Everyone's needs are different. Just because your mom had this company or your brother had this company or Aunt Susan's best friend told you you don't need to get this company, that may not be what's right for you. So sit down with somebody or go to Medicare.gov and do your own research if you feel the need to do that. You can. Medicare.gov will give you the information you need, but it is very time-consuming and it's confusing.
It is confusing. And I have had, Medicare specialists on this podcast several times. I have talked to people on Medicare. And when it came time for me to decide for Mark, it was so important to me that I get this right because, with his health issues, I've spent so much money out of pocket. So I was very excited, excited about Medicare. But I couldn't have figured this out on my own. And for us, and this is why I think it's important, you need to talk to someone who specializes in this. And I'm just going to talk from my heart with this, is that for us, what made sense is traditional Medicare with the supplement. I want to be able to call the shots and go to whatever doctor I want for Mark. I did not want to do an Advantage. It may be right for some people. It is less expensive, but I have seen that there are some restrictions. Like if you want to go to a certain rehab, it's not in the network. You can't go. So just working with seniors, I personally have seen some things that would not set well with me because I want to go where I want to go. And plus, if we were to travel. So you really have to think this through. The other thing I want to mention is that if you're so you choose an Advantage plan, you're healthy, and you're like, this is great. This has a lot of things, dental and stuff included, and it's cheaper. If you end up with something like cancer down the road, you can't switch over to traditional, correct?
That's partially true.
Okay.
The first year that you go on to an Advantage plan, when you first go into Medicare, they don't ask you any health questions going on to a supplement, which is really great for a lot of people. You have 1 year trial right period. If you go into an Advantage plan for the first time, let's say you had original Medicare with a supplement and you decided that you want to try an Advantage plan, you have a trial right period. You have 1 year to try it. And if you don't like it, you can go back to original Medicare and a supplement without them asking underwriting questions. And therefore, it could decline you if they needed to because they're health sensitive. So not here to say one is better than the other by any means. But that's why I say sit down with somebody who can show you both sides and don't just try to cram one product down your throat, because it's really important to take your specific needs into consideration. You want to make sure if you do go an Advantage plan, you want to make sure your doctors and your specialists are all in network, that you put your medications in there to make sure that you find a plan that is not going to cost you more than perhaps another plan would. So just weigh the benefits.
Do you need a drug plan if you're on an Advantage, or it's all
No,
in one?
Usually the drug plans are included in the Medicare Advantage MAPD, Medicare Advantage prescription drug plans.
Oh, okay.
There are some Medicare Advantage plans that are only MA. They don't have drug plans on them. If you're getting your credible prescription drug coverage through, say, the VA, that's considered credible coverage. So you wouldn't have to have prescription drug coverage through your Advantage plan.
Okay.
There are, again, options.
Are your heads spinning? Because this is what happens. And I've heard this so many times that I'm still like, huh? Okay, sure. But find someone that you trust, and like Annette said, that works with all different plans. Don't just go to someone who all they specialize in is Medicare Advantage. And I know there was a lady here in town, that's all she did, and that's all she would talk to people about. And that it could be great for you, but you need to know the disadvantages and the advantages of each type so that you can make a decision. And like Annette said, I mean, when you go on Medicare, this is your one time that you go on without, they're not going to deny you, because, if I tried to get Mark on insurance, regular insurance, going, yes, he survived 4 strokes.
They would laugh.
He has seizures.
Say, no way. Well, I will give you an example. My own father was on an Advantage plan. He was on an HMO plan. It was managed care, and that worked great for him because he wasn't going to leave his hometown, Garland, right down the road. He had 13 specialists that he saw on a regular basis. That was their social life, was going to the doctor. And he went on a regular basis. His maximum out of pocket that year was $3,900. I think that year he went to the hospital. He had a heart stent placed. He had some complications, but he only paid about $2,500 out of pocket for that whole year. So I'm not saying anything against Advantage plans. They can work great in the right instance.
So for him, and just for myself, kind of clearing this up, so he ended up paying $2,500 out of pocket. Now, with what I have for Mark, with A, B, the supplement, everything, I'm not going to pay anything other than, what is it? The
monthly premium. The
monthly
$185 you have to pay for both sides, right? One other thing I do want to mention, that there are some plans that are chronic special needs Advantage plans for people who have, say, heart disease or diabetes. There are some chronic plans. There's also some dual special needs plans for people who are on Medicare and Medicaid. So again, talk to somebody who has all the options available for you, not just somebody who only sells one type of plan with one company. That's all I'll say about that.
And someone like Annette, who just, I didn't know about VA. I didn't know about the dual. I learn something new every day.
That's right.
So, Annette, I don't think we said, but you are licensed in Texas and Florida?
Florida, also? Georgia. I've got a few other states under my belt.
Okay. But you're with AmeriLife, and they're based out of Florida. And are they throughout the USA? Or?
We have several offices all over the U.S.
Kind of all over.
A big company,
But you can, if someone calls you, say you're in Montana, I just randomly threw that out there.
I can go onto our system and look up and say, who's licensed in Montana? Can you help them?
Perfect. So if you're in Montana, by the way, I've never been to Montana, and I really, really want to go there sometime. I hear it's beautiful.
Right now.
Really?
Yeah, my friend is there right now.
It's so beautiful. One day I'm going to go there. But anyhow, shout out to Montana. So, but if you need help wherever you are in the U.S., this is complicated. I really would say don't try to figure this out on your own. Talk to someone who does this every day and who is a professional.
And let me just remind you, annual enrollment period, October 15th through December 7th. The new plans actually will be notified tomorrow, but we can't even talk about these plans until October 8th, and no enrollments can be done until October 15th. So this is your window. If you're on an Advantage plan or a prescription drug plan, this is your 7-week window that you can actually sit down and look at your options for next year.
So for Mark, sorry, it's not all about Mark. Well, it kind of is right now. We don't have to worry about the Advantage plan, but it's his medication. We want to look at his prescription plan and see if anything has changed in that.
That's exactly right. We will do that.
I didn't even realize this. Good timing on this podcast. Okay, so this is great information.
Thank you.
And we'll have in the show notes how to reach Annette. Anything else you want to add?
No, just talk to somebody that knows what you're doing. I'm not going to try to sell anything like that. I just think it's really important to talk to somebody who's qualified and certified and knows what they're talking about. So,
and across all plans, not just married to one plan.
There you go.
So anyhow, we'll have all of Annette's information in the show notes. We'll also have some links back to other shows we've done on Medicare, because it's like the more times you hear it and you hear it in different ways, it finally kind of starts clicking in your brain. But you don't need to completely understand it. You just need to find a specialist to make sure that they're explaining it correctly to you, and it's going to work for what you need for yourself or your loved one.
There you go.
All right. Well, thank you so much, Annette.
Thank you, Lori. I really enjoyed being here.
I've enjoyed having you here. And thank you. Thank you for always helping me. I call Annette all the time with questions.
I love it. It makes me happy.
Good. All right. Thanks for listening, and y'all tune in next week. Thanks. Bye-bye.